Hello, my name is Samuel Jarman. I have the pleasure of presenting quite a few things at the Canadian Massage Conference in Burlington in September. So I have an online session, Osteopathy in the Cranial Field, and what we're going to look at there is historical developments, how the claims were made, some of the claims, comparing that to modern research and seeing whether or not it essentially holds up. So whether or not the claims hold up in light of current research. So that's the online one. I have a demo on the Friday, which is titled, Does Treating the Head Have Diffuse Effects? So essentially what we're going to do is look at whether or not treating in the region, in the cranial region, has diffuse effects throughout the body. So we'll have quite a few tests that we'll run a patient through. We'll treat in the region of the head, and then we will rerun those tests to see if it has a diffuse effect. Because cranial work has positive effects, but the question is whether or not it has diffuse effects. Does it do something broadly to the patient? I have an MTM talk called Don't Believe the Hype. I don't remember the full title. I'm just going to look that up right now. Don't Believe the Hype, the philosophy of science is a big deal. So for myself, having gotten my master's, done a thesis experiment, the philosophy of science informs the choices that you make when attempting to develop knowledge. So that's my MTM talk. I have two in-person sessions. One is effective assessment and treatment of the lumbopelvic region, where participants are going to develop their own effective assessment and treatment of the lumbopelvic region based on some very, very straightforward concepts that anybody with a hands-on background can take on and then develop their own techniques or their own methods. So we're trying to give you the tools to make your own treatment approaches and your own assessment approaches. The other one, the other in-person session, is assessment is about movement, not what you think it's about. Right? So essentially what we're going to be talking about is that the practitioner is in an external environment of observation. So the structures that are underneath are obscure to them. They will use movement to get proxy information, but that proxy information is not as accurate as we would hope. So that's what we're going to talk about there. So we're going to take you through how you develop an assessment and how you make accurate assessments without making much change to what you're already doing. So your behavior as a massage therapist is already good, but we're going to talk to you about your interpretation. We're going to help you be more accurate in your interpretation of your assessment findings as opposed to just the claims that you've been taught to make.
Hi everybody, my name is Sean Michael Lattimore. I am a registered massage therapist and manual osteopathic practitioner. I've been doing this for over 20 years now. My background of fame is I see over 100 patients a week, just working smarter, not harder. So I treat on a session-based technique, which most therapists don't talk about. This coming weekend at the Canadian Massage Conference in September, I'll be talking about my advanced cranial sacral therapy course for concussion therapy. So we'll be going over how the brain is a 360 and how it's just not one impact here, but it's also getting another impact on the other side, and treating all the cranial nerves, because most therapists never treat the cranial nerves. So I'll be talking about every single cranial nerve in the head and how as a therapist we can actually affect those to actually get rid of a concussion manually, because a lot of concussions don't show up in an MRI or a CAT scan. The other thing I'm going to actually do is, for the first time ever, I'm going to do my $1 million massage talk, and it's going to be about how certain techniques will actually get you money, how you don't have to spend an hour actually treating your patients, and just if you do 5-10 minutes of one technique, getting the same results as you do as an hour, but then you can actually scale yourself up just like I do to see 30 to 40 patients in a day or in a week. So instead of seeing 5-10 a day, you can actually see 20 a day, and then you can see up to over 100 patients like I do. And I'll actually be showing you guys the techniques I actually perform in my practice every single day to actually do that, and actually go over the strategies of how to market yourself as a therapist doing this in some business sense, and actually show you guys how you can actually make between 20 to 30K a month just as a therapist doing this type of work. So it's going to be really exciting. It's going to be really new. It's the first time I'm doing this talk, so I'm very excited about showing you guys all the trades and secrets. I'll also be doing my live demos. So we're going to mix it up on the demo session. We're going to just see whatever comes our way. I'll be showing you guys some of the techniques that I use every day in my practice to actually do specific treatments, but it could do anything from a concussion, it could do women's health, it could do just overall sports treatment. So we're just going to have some fun and play around with that session. on the demo session. So looking really forward to seeing you guys there. And now me and Samuel are actually going to have a fun discussion with the overlapping between osteopathy and massage therapy and how there's this good correlation between the two. I started off as a deep tissue massage therapist with a sports background, and the main thing is I wanted to save my hands. So how could I effectively save my hands and save my back? Because most therapists end up injuring themselves within the first 2 to 5 years. And for my route, osteopathy was the way to go. So the big things is crossover with craniosacral, muscle energy, visceral treatment. So those things really help us actually be specific, but also help massage therapists actually relax a lot longer in the system than actually going out within 2 to 5 years. And I think Samuel can testify to that, how we can actually work smarter, not harder with our techniques.
Yeah, so I don't have the background as a massage therapist, so it's actually useful, and we'll go back and forth about this, to rely on your background and your experience with that massage therapy work that you've done in the past, Sean. One of the things that I will say with the concept of working smarter, not harder, the central feature of osteopathy that allows a practitioner to do that is the barrier concept. Now, there can be a lot of disagreement about how to express this, but the easiest way that I've found across time to express the barrier concept is simply don't make the patient say out. The direct barrier, which is the barrier of restriction, so the way that they have a hard time going, and you have essentially the indirect barrier, the way they have an easy time going. If the patient says ouch when you take them into the restriction, you don't do that. If they actively move and they're in a lot of pain, you just don't do that. You get the choice to go indirect, or to soften the soft tissues, take the tension off, not put tension in and beat it up, but take tension off. If they can go into the direction of restriction or into the direct barrier and they don't say ouch, you go short of that. That allows you to be more specified and gentler, which means that you as a practitioner are able to use less effort to get a similar result. You're assuming that you're relying on underlying neuromuscular mechanisms. We're not 100% sure which mechanism it is, but we know that the behavior is repetitive. We can do it over and over and again and get a reasonable range of positive results. Whereas, and you can speak to Sean, I don't know if this is what you actually experienced, but it seems like the general momentum of the profession is wherever the patient says ouch, just beat it to submission. Is that what you experienced?
Yeah, usually if they have like a knot or something, we're taught, okay, I gotta get my elbow there, I gotta hold the knot, instead of actually fascial releasing the knot so I don't ingrain that trigger point into the client. And what I like about osteopathy is we can actually turn our assessment techniques into actually treatment techniques as well too. Yep. So we actually get a baseline assessment with our osteo assessment techniques and actually turn them into techniques overall to get actually a release on the spot. So we're actually going to the root cause and actually treating the structural problem that's actually going on, either it's emotional, spiritual, or physical in the client, to actually get that overall release.
Yeah, so at any point that an osteopathic practitioner is moving a patient, if they note a restriction, especially in a paired structure, so they check your right arm and they check your left arm, the assessment is the movement in and of itself, and then the treatment is easily done by using that assessment motion and making the barrier choice. So as I already noted, the barrier choice being into the restriction or softening the soft tissues to work indirect, that assessment methodology is a movement-based treatment technique immediately, as long as you're paying attention to whether or not the tissue feedback is giving you what you're hoping it will give you. So as Sean notes, it's just an immediate switch. You don't have to go back through your brain and remember, okay, when I find this problem here, this is the move I'm supposed to use. You can develop it on the fly. So if you know how a body's supposed to move, you put it through some movements, you find a restriction, and you go ahead and you engage the barrier. Now, there are ways in which you can use different activating forces. So as Sean noted, you can do things like myofascial release. You can do things like articulation, which is really just rhythmic on and off. People can call that oscillation. There's lots of different terms that we can get to, but Sean makes a salient point in that your assessment is immediately your treatment simply by making a choice on the barrier. That also allows you to reduce your cognitive load. You don't have to remember a lot of stuff. You just found that the thing didn't move. Now you have very few choices to make, and you can have an effective, specific change that is mechanically easier on the practitioner because you don't have to get your elbow into it. You don't have to have the deep stance. And you can actually remove almost all the load. You can make the patient do a lot of the work for you. So that's another activating force, right? So anything to add with respect to that? Because you're pointing to, at least to point to the difference between, you know, they say ouch here, let's dig my elbow, and you do an assessment, you find the problem, and you can go right to work.
The other big thing is the work actually an emotional response? Because are they saying ouch because they're actually holding something in? So like lungs are grief, liver's anger, kidneys are fear. Is it something actually with the tissues that's pulling on a different area? Say I can't move my right shoulder, I can't get up overhead. Is it because I'm so angry in my liver? If I get liver tension to move, then the shoulder can move back and forth. So it's looking at the different components that actually treat that, because a lot of times we're just in there, we're relaxing people, we're treating the vagus nerve, we're relaxing the vagal tone in the actual person. But if we actually look at it from an actual emotional response, or what has this person actually gone through in their life that's causing these different tensions in the body, and said, okay, I'm just going to massage and relax this person. If you look at it from the osteopathic spread, why is that happening? What's going on? Are they having problems at home with their kids? Are they going through a divorce? Do they just get out of the hospital? Is there some sort of traumatic event that just happened in their bodies that are actually storing this? And then can we structurally make their life easier by loosening up that thing, and also emotionally releasing that tension so they can sleep better at night, they can eat better at night, they can work better. It makes their overall health much easier as an individual, just looking at it from a wider perspective. Is it their foot is out of alignment because they're standing too far forward, which is causing their headaches because their head is stuck like this? If we change the foot and the balance, then their overall body actually accepts those changes and then starts to calm down. So we're really looking at it from a broader point of view, not just the soft tissues, but also the visceral, the cranial, all the nervous system, how to relax the nervous system. So it's actually treating everything interconnected together. But we're working smarter and simpler than, okay, I got to do this deep tissue massage and then I can only do 5 treatments a day. If we look at it from this bigger point of view, then instead of 5, I can do 8, I can do 10 a day, and then it saves our body as individuals. But we're not working as hard because we're going right to where the problem is. And we're working at why is the problem there, which we don't ask enough as therapists. Why is this here? What can we do further down the line to help this person? And also too, not having them once a month for a treatment. I need to see you 2 to 3 times a week for the next 2 to 3 weeks to fix this issue. So we actually fix whatever is going on, and then they build the trust with the therapist because they're in more often. Then we can actually get more clients and more business from doing this, and said, oh, your benefits are $500. I'll see you once a month for the next couple weeks, and that's it for the rest of the year. We're actually giving a lifestyle purpose, a lifestyle change to the clients.
Yeah, so I think to kind of continue on, and maybe to allow the opportunity to note that there's different approaches even within osteopathy. So I think that what Sean is saying, especially with talking about things like emotional release, there's definitely value in that concept for a lot of different practitioners. I think for massage therapists, that may not necessarily be as important. You can be exceptionally interested in it and you can learn as much as you like. What I would say is that the benefit to talk to what Sean is noting about the ability to treat with more mechanical effectiveness and less physical effort is the thing that really will be something, right? So less hard work, right? Where that external environment of observation makes it much harder for us to appropriately understand as practitioners what's going on inside the patient, but we can understand emotion. So the ability to interpret that can go a lot of ways, because the same motion restriction can be found. This is a classic refrain in osteopathy. If you have 5 osteopaths in a room, you have 10 different opinions on the same motion problem, right? So there's lots of different ways within osteopathy to interpret the same finding, right? There's the bioenergetic interpretation, there's the visceral interpretation, there's the cranial interpretation. So the visceral interpretation of a right shoulder problem could be gallbladder. It could be anger, it could be the lung, right? There's lots of different interpretations. The value for a massage therapist with osteopathic methods is probably not living there. It's probably living more in what Sean's pointing to with respect to the ability to see a patient in less time, just as, if not more effective, with less physical work. And the thing that really unlocks that is the barrier concept, is what Sean already noted of the assessment method is the treatment method often, and then that's guided by the barrier concept. As well, osteopathic methods historically are based on leverage. So you have a short lever, which is directly on the tissue that you're interacting with, or the joint that you're interacting with, or the structure you're interacting with. You have long lever, which is using something distant to mobilize the thing you're curious in. Then you have mixed lever, so the short lever hand and the long lever hand. So I'm pulling on your leg with my hand on your abdomen, and really I'm aiming at your abdomen. So I have that mixed leverage approach. That levered approach is the thing that takes a lot of the effort away. So as much as the interpretations, the varied interpretations within osteopathy could be very interesting to people of all professions, they're so varied within osteopathy, you rarely get agreement on them. People will have their preferred interpretations, and it will provide really good clinical behavior for them, but you're going to have a lot of disagreement. So for myself as an individual, I tend to pull back to the behavior more than I pull into the varying interpretations that have a lot of arguments within the profession. So those arguments within the profession are not necessarily that interesting to people outside of it. They can be very interesting to, say, myself and Sean, or any other osteopathic practitioner. But the thing that I think both of us and the osteopathic practitioners such as Tara and such as Carrie will be able to really impart deeply to the massage therapists at the conference is that more effective mechanical leverage-based approach, and that quicker decision point of my assessment turns into my treatment immediately just by making a barrier choice. So hopefully there's not too much lag on my side. Did all that make sense for you, Sean? Did you have anything to add to it?
Yeah, I think the big thing is actually looking what's in our toolbox, because we get all these different tools and like, what do we do? Oh, this one does this one does this one. But if we actually look at everything that every presenter presents, it all crosses over. Mm-hmm. Like cupping. Absolutely. My good friend Paul, he does the cupping. What is he doing? He's releasing myofascial. What am I doing with my hands? I'm releasing myofascial. My good friend Tara Nicole, she does the pelvic floor work, which she's working on with the different diaphragms. It still does the same thing. My great friend Carrie, he does the energetic work with the structural stuff, with the full total body balancing. So it's all about what tools do we use in our toolbox to get the same concept, because we're all talking about the same thing. It's all about what are we actually doing as a therapist, because I can use visceral, I can use cranial, I can use myofascial, I can do muscle energy, I can do still point techniques, I can do a lot of stuff. But what is it going to get with our clients? The whole end result is, are we looking at that person as a person and getting them what their goal is? What is that person's goal? Can I actually lift my arm over my head? Or is it, I need to lift my arm overhead so I can do it with my child? So it's looking at the person as a whole instead of, okay, this doesn't move well. It's, again, the why. Why is it not well? Why is it not working? And then what tools can I do to get the best outcome for that person? So if that person is myself, I always look at it, if that client in front of me is me, what can I do for them to better their life? What technique out of all my toolbox can I do, get the quickest result, the fastest result, and get them back and performing? Especially working with sports stuff with the Olympics and different athletes I have, professional athletes. I need to get those guys back out as quick as I can to do their job they can. And then after the event, then I'll take care of all these other things. But what is it they're doing and why is, I think, the big thing. And then using all those different tools in there to get the restrictions, to get the barriers, to get all the points out that need to be addressed. But it's all about assessing properly, working smarter, and then looking at the whole as a unit.
Yeah, so just as you noted, like all of the presenters who are fantastic that you noted, we're all looking for the same thing. So what I would argue is that the same thing that we're looking for is our assessment is testing a motion. That motion could either be the motion of a joint or the yield of a soft tissue to pressure. So when pressure is added to a soft tissue, it should yield similar to the same soft tissue in its own region. So massage therapists do that. Massage therapists definitely do gross motion testing, right? All of that is crossed over between varying toolboxes. which is why I tend to zoom back to the behavior. What are the behaviors that are similar between all these things? And then to have some way to teach others how to do that. So instead of being as concerned about the stories that are told, what's the same, what's the same, what's the same? The assessment is the strong suit of osteopathy, as is the use of leverage and the use of the barrier concept. So if you take any methods, let's just say you take cupping. Cupping done with the concept of an appropriate assessment followed by appropriate use of leverage, because the cup allows you to get more leverage on soft tissues. Then you can apply, say, a mixed lever approach. So you can take a cup, put tension on that cup, and then start moving the bones in relation to it. So you can put a cup right on the person's forearm. See if I can do this. Put it on the person's forearm, and then put tension on that tissue, and you can start moving their forearm. You can start moving those bones. That's osteopathic, in that osteopathic soft tissue work tends to be perpendicular to fiber direction, and then you have this concept of one thing stays still, one thing moves in relation to it. So I call it relational motion. That is done by all practitioners, but the leverage-based approach to reduce the work is the thing that osteopathy tends to be strong at. Now, I've seen a lot of so-called osteopathic methods done by people who have no osteopathic training and have training in just a specific hands-on practice. So it's not fair to say that that's an osteopathic method because it's done in another practice. But what it is fair to say is that the osteopathic difference would be the barrier concept and that efficiency-based approach, right? So the crossover that you brought up between all these methodologies and all these tools in these toolboxes is exceptionally important. So thanks for that, Sean. Was there anything else that would be useful to talk about aimed at massage therapists that osteopathy uniquely could provide them for effectiveness in their practice? You already talked about the ability to see more patients. So from the economic standpoint, that ends up being a better volume-based approach. So for the individual practitioner, they work less, they put less physical work in and they make more money as a result of it. So is there anything else you potential attendees for the conference?
I think one of the big things is using some of these tools. It doesn't matter if you're a chiro, physio, acupuncture, massage, physiotherapy assistant, whatever your background is. Learning a few of these techniques, you can actually cut your treatment times down as well too, because we don't talk about that enough in the industry. We talk about, I have to do a 1 hour massage, I have to do a 1 hour treatment. Why? We don't talk about that. Why do you have to do that? Why don't you charge for just whatever that service is that you're doing? If I see this person for 15 minutes and I get the same results that spends me an hour because I'm using better tools, why aren't we doing that? And that's what I think the big part is that a lot of people can learn from this weekend coming up with everyone there, is you don't have to get in what everybody else is doing. That's what I do. I just charge for the work I'm doing for what I'm worth, not for what the service is worth. And we don't honor that as a therapist, what our value is. And this is why a lot of massage therapists hit the fatigue level. They can't use their hands anymore. They get exhausted with the work because it's so repetitive. If you're doing the Swedish massage every day, it's straining on your body. I used to be deep tissue, my elbows, and I was getting ulnar nerve entrapment and carpal in the hands. Why was I doing that? That's just what we're taught in school, but there's so much more out there outside of school. And this is what I like about the osteo, is when I started doing the training there, it's like, I learned a few things wrong in massage school. Now I'm actually learning how to do things right. But with the presenters there that are at the conference, you're taking these little small toolboxes and you're applying them for different areas. So if it's like James Walsky with his shoulder, you're learning just how to treat the shoulder. Why aren't we doing a shoulder protocol? Why aren't we just saying, okay, this is the protocol for your shoulder. I'm going to do this, this, and this. And next time I see you, we're going to do this again. If we do it more like that, then the whole concept of this hour situation goes out the window. And that's what I like about this, is combining different little things together to get better results. But it's treating everything as an aspect. Okay, if here's a headache protocol, here's an ankle protocol, here's a pelvic health protocol, here's okay, you got your wrist. This is a joint protocol for the wrist, and then giving them the rehab exercises around that. Then we can see people more often. We can charge more for seeing them less, and then we can actually get better results with them. So we're touching on those main goals of how to actually expand your knowledge and time to more people. And instead of having a wait list, you cut your wait list down, because now you can actually get people in the door.
Yeah, so I think just the concept of a volume-based approach to business is useful. Now, the way that you're suggesting everybody get there is by reducing cognitive load. So you talk about like a shoulder protocol or a headache protocol or a pelvic health protocol. Within those protocols, you have a bunch of moves that you would go through, and if upon assessment there was no problem noted, you move on to the next one. So that protocol-based approach does allow for some reduction in cognitive load, increase in efficiency, because you're like, okay, I look here, 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 and here. I think that approach has some value, and I think that approach can be quite useful to some people, and other people won't necessarily jive with it. But the outcome-based interaction with the patient, that can definitely be hard for massage therapists, because massage therapy, at least within Ontario, has a lot of momentum behind it. People access it as a service, and they have certain expectations because this is kind of how it goes, right? So there's a normative culture around it whereby you book on time. It's one of the best ways to manage a multi-room space. It's one of the best ways to manage anybody's day. And it's one of the easiest ways because it's what you get taught. There's definitely different ways to do it. As Sean was noting, you could be interfacing with a patient based on, this is the problem I found, I'm going to get it moving, and then you're going to come in another time. We're going to reassess, I'm going to work on that problem, you're going to come in another time. That could be 5 minutes, that could be 15, that could be 40. It depends on the circumstance. So you can definitely run your practice that way. You can run your practice basically by scheduling 15-minute slots, using 1 to 15 minutes within that, right? That's definitely an option. There's lots of options that way. The thing that will allow you to do that is to be as effective as possible with as little work as possible, which is what will be highlighted in a lot of the osteopathic sessions. Think less, treat more specifically, more efficiently, by not necessarily trying to beat something into submission. Just try to get it to move better. Reassess regularly so that you find out if it moves better. If it moves better, you don't have to do the rest of your moves. So if Sean talks about a shoulder protocol, you have 5 moves in your shoulder protocol. Move 1 or assessment move 1, you find nothing. Assessment move 2, you find something. You do something simple to assessment move 2, it starts moving better because you're reassessed. You move to assessment move 3, there's no problems. Assessment move 4, there's no problems. Assessment move 5, you find a problem. Well, same thing. You do something simple to it, you retest it. If it's moving better, you're done. Rerun all those assessments. Let's just say that took you 5 minutes. Well, five minutes out of a 15-minute slot, you did your work. The patient has the positive outcome that they're looking for. Now, your general mental and cognitive load can be reduced. Your physical load is reduced, and then your ability to see more patients more effectively has improved. So that leverage-based approach, that mechanical efficiency-based approach, that diagnostic consistency-based approach can really help you manage your load. That's definitely something that you'll see in some osteopathic practices, not all. Some osteopathic practices, and this is the variation in any profession, some osteopathic practitioners prefer to work on the hour or work on the 45 or work on the half hour. So the nice thing that Sean acts as an example of is somebody who made a purposeful choice, set up systems so that he could enact effective results within that choice, right? So his choice is, I want to work less strenuously, I want to see a higher volume of patients, and I want to do it more effectively. So he went out and got those skill sets, he set it up, and he's standardized his approaches so that he can do it. Now, for myself as an individual, my assessment approaches are quite standardized. My treatment approaches will be very, very unique to the patient, right? So there's a difference between how Sean practices and I practice, not necessarily in assessment, but maybe in scheduling. Right? Myself as an individual, one of the other things that I'm doing is opening a school in the Osteopathic Lyceum. So my attention's pulled in a lot of different directions. I got a master's degree not that long ago. So I prefer my attention pulled in multiple directions. Whereas Sean, and you can correct me if I'm wrong, Sean really gets lit up by helping as many people as possible, as effectively as possible. Is that fair?
I actually think it's the opposite. I think we're actually doing the exact same thing. We're actually
Right on.
working the exact same way, but the only difference is the specifics. Like if my full assessment is still an hour long, I'm still doing an hour assessment so I can get to know the person. That it's my process afterwards. But because of the experience level I have with seeing over 100 clients a week, I can see what is normal going on with each person because of experience levels. And that makes a big difference. If you're a therapist and you're only seeing 10 people a week, you're not seeing the same thing over and over again. So you're not developing those techniques that actually get you further. And I'm more valuing my value as a therapist instead of what the standard is. And that's the big thing is my value is to get that person better. If I say they need to see a half hour, I will do the half hour, but I'm still getting the same result as you are with your patients because it's the same approach no matter what. And I think that's one of the big thing is we keep saying we do different things. We don't all do different things. Everybody of us is doing the same thing. We're just looking at it from a different perspective. And that's the big thing with it. And I think that's one of the things that gets mixed up too much in the osteopathic community. Every osteopath is doing the same thing. If you're British trained, you're European trained, you're an osteopath in the States, we're all looking at it from the same perspective. It's just what tools do each of us use that are more effective? And that's what I like with this conference is there's lots of us from all these different trainings and backgrounds, but we're all doing the exact same thing if you actually look at it. So every technique correlates with the same thing, and at the end of the day, it's about getting that person on the table better. And I think that's sometimes we forget about that. We're thinking about ourselves as therapists. If we focus our energy on the patient on the table and get them better, get them what they need, like I said, the why, then it doesn't matter what each one of us does, we're getting the same results that the individual wants. And that's the big thing with treatment plans is we don't talk about that as massage therapists. Treatment plan, this is what I want to do for you for the next little bit. It's more like, again, once a month, you need to come in, relax, decompress. No, I need to see you once a month so we can get the stress in your life taken care of better so you can function on an everyday purpose. And the stuff that we bring together as osteopaths is we can do the same tools to get the same result as a massage, but we can actually get a couple layers deeper. We can get a couple layers deeper into the emotional front, the structural point, the balance point, the actual why the problem is there, to actually help these people further so they can tell more people and come back so they actually feel better instead of it's one and done, which is very common in the massage community. Is you see that person one time for a relaxation massage and they might never come back, or they might come back a year later or 2 years later for the same issue that they had, where we can actually resolve that on the spot and help the person get better on the thing. But it's all about, as a therapist, what do I see? And what I see is going to be different from Samuel, it's going to be different from Tara, it's going to be different from Carrie, but we're all going to get the same result as a therapist because we're looking after the person in front of us.
Yeah, so I think the converging point is that we're all working on the same basic substrate, which is members of the general public, which is humans, which are people with motion problems and associated symptoms being something only the patient can identify. So a sensation internal to them. So the substrate's all the same. Yeah, the interpretations will be different. The stories that we tell will be different. The manner in which we come to it will be different, but the net result will be the patient will move more effectively and have a change in sensation as a result of that. So I think the convergence is definitely there with all hands-on professions. I think the thing that I'll say when I'm pointing to people doing things differently, I'm really pointing more sort of cognition, how they think about stuff or the interpretations. That's why I bring up the concept that if you have 5 osteopaths in a room, you have 10 different opinions on the same finding. That's why I say that. So I think the general substrate and the convergence is we're all trying for the same net result, which is a change in the quality of the patient's life as mediated through a hands-on movement-based intervention that will alter sensation in the way that the patient hopes for as effectively as possible, right? So if we talk about assessment, so where you talk about your standardized is an hour, my standardized assessment on every treatment, full on to figure out where the heck I need to go further takes me no more than 2 minutes. So I've standardized a way to get through the body very quickly to find out where it needs more investigation, right? So that's the same, for instance, in practice, but as you note, our goal is the same. Get the patient more effective, more efficient, get them a change in sensation that they desire so that we can keep them moving. All right, so anything else to add to the conversation in general?
I think the good part is, as you mentioned, is like we're constantly assessing throughout the whole treatment. So as we're going, we're not just doing the assessment at the beginning. Through the whole session, we're doing the treatment of assessing, and it's different types of assessment. We could assess on breathing, we can assess on cranial rhythm, we can assess on how the tissue moves. We can actually assess, oh, does this hurt when I poke here? Ow, I get an ouch. Okay, why is that an ouch in that area? Is it where it's actually coming from? Is it coming from the ankle and going up? We can actually trace that whole movement as a therapist doing some of these osteo techniques. So instead of just massaging away at doing these deep tissue releases or the Swedish work, just going in light, you can actually say, okay, why is this leg not moving properly as you're actually doing it? So we're actually thinking as we're doing the treatment instead of just free forming it as we go. So I think that's the one of the biggest thing is we're not just, okay, going and doing the technique for sake of doing the technique. We're doing the technique with intention, or we're being direct or indirect in our technique basis just to figure out what's going on, but it's also an assessment at the same time. So we're working and assessing as we go, and each time we touch that person too, we're going to get a different assessment as well too, because things are progressing, things are layering. So the deep stuff that I had on the first session might be in the mid layer, and then it comes to the surface layer because we're actually bringing it out of the body for the body to heal. And that's what's really good about the work that we do, is it really corresponds to that individual of bringing it layer up. I always call it, is we're getting the deep stuff to come to the surface, and then we're actually getting them to actually heal in front of us. We're actually having miracles happen every day in front of us, which is amazing to see with our patients.
Yeah, so I think that's an important point, is assessment is consistent throughout the treatment. So you assess initially, you have a touch point. So you're never at a loss to know if you have done what you needed to do for the problem you found. You find a problem with assessment, you apply a treatment method, and you reassess immediately with the same method that you assessed initially. So you don't do supine cervical rotation to find a problem and then do lateral cervical rotation to figure out if it changed, right? You keep picking the same place, your assessment, your reassessment are the same methods, and you're consistent. So you always know if you did what you were supposed to do, because you use your assessment method to find it, you treat it, you reuse your assessment method. If it didn't do what you need, you get the choice to use another method to try it again or do something different, right? So you have that choice point and that touch point. Within an osteopathic approach, you never are at a lack for knowing if you did what you were supposed to do, because you reassess, so you figure out if you hit that touch point. So you know if you did your job right all the time. You're not left guessing. You're not in that situation where the patient asked for something, you treated them to the best of your ability, and they come back next year. You're not in that position. Whether they never come back or again with an osteopathic approach, you know if you did your job, right? So that's a very important point, that consistent assessment, and that we are really all aiming for the best outcome for the patient regardless of profession. So hopefully of allowing people some insight into how osteopathic methodologies are going to really benefit massage therapists and any attendee of the Canadian Massage Conference, because it's open to all kinds of practitioners. You don't have to be a massage therapist to come. So hopefully that's been a useful conversation between us and Sean to bring up our perspectives on how osteopathy is a really high leverage approach that can benefit a current massage practice. I mean, myself, as somebody who's opening a school, I obviously think it's great, and I am a type 2 school, so I'm actually looking for students who have a previous hands-on background. So massage therapists are perfect candidates for my school if they want to become an osteopathic practitioner, as well as maintain their massage practice or do whatever they like with it. So again, hopefully that was a really, really useful discussion to provide some of that insight. Do you have anything else to finish up with, Sean?
I think we mentioned everything, which is great. I think the main thing is check out all the different practitioners that are going to be there and really feel how different each one of us is. Check out my class, check out Samuel's class, check out Carrie's class, check out Tara's class. really see the difference between everything, but we're all getting the same thing. So we look really forward to seeing all you guys there at the conference in September, and we look forward to teaching you guys everything there. And like I always say, we're giving you different tools to better yourselves as therapists so you can last longer in this profession. So I think that's the main thing with osteo, is getting you to last longer in this profession and saving your bodies, but also taking it a step further in our knowledge as well too. So I look forward to seeing some of you guys in my class. If anybody wants more information, they can check me out at info@Dynamic Health Therapy, or follow me on my Instagram page at dynamichealththerapy.com.
Yeah, so my website is osteopathiclyceum.com. Instagram is osteopathic lyceum. And so it's just all osteopathic lyceum. I have a YouTube channel, so there's a bunch of technical videos up there, and I have podcast discussions up there that I run myself. I definitely look forward to seeing everybody, and I look forward to seeing the Canadian Massage Conference crew, the Massage Therapy Media crew. I look forward to seeing you in person, Sean, and having a great time, and hopefully not making too many inappropriate jokes in person.
And check out more stuff that's on Massage Therapy Media as well too, because me and Samuel have lots of content on there. It's a great asset to use, so all you therapists that aren't using it should start using it right now, and look at the different stuff that all of us have participated in Massage Therapy Media. So we look forward to seeing you in September.
Yeah, thank you very much, and we hope to see you very soon.